inferior, to the nuntial area. So atlas, transverse process would be right, remember we go from the, it should be right in here. Is that tender to you? Yeah, right, sorry. Right in there, that's always very tender. So it goes like up in here. And that one helps to rotate the head, tilt also, and rock the head. So when you palpate for this one, have the patient rotate, the person rotate, and you should be able to feel it contract in here. This is the oblique superior, okay? And then the minor is you can't palpate it, or inferior, I'm sorry, the inferior you can't palpate. It's from the C2 spinous process to the transverse process of atlas. So that's kind of, should be right in here to right in here. All right, again, that one is tilting, okay? And don't worry too much, just know basically where they are, know their actions, all right? That's what I'm concerned with, because they're kind of hard to palpate. All right, and then I want you to go in and we did the occiput. The scapula you're responsible for, okay, because we need to know, I'm going to have you counting the interspinous spaces, right? So here's the scapula, do the inferior angle, bring it down, that's important, then come right across, feel that interspinous space right here. That would be T7. All right, and then you would count up, find the acromion process, the spine of the scapula, okay? And right here is your medial angle, or the root of the spine of scapular, and right across here should be your T3. Up here is your superior angle, okay? And that's at T2, all right? And then this would be the border, okay? The medial border, the axillary border, your glenoid fossa would be in here. In front, you would have that coracoid process, okay? Right down, right here is his, just inferior from the clavicle, all right? And let's see, what else do I want you? So you're going to palpate. You're going to get the bones then. Give me a couple of the spine, the vertebra. All right. Well, they're going to be disarticulated. I'll have them on the table. And I'm going to expect you to know, put a thoracic, this is what you pick, or that's what I pick. Thoracic vertebra would be in here. Cervical vertebra would be up here. Okay? Make sure you pick a cervical, right? And then the lumbar vertebra would be down in here. Okay? And make sure you pick a lumbar vertebra, okay? So we have to know the basic traits, right? All right, triangular for lumbar. This is the vertebral. I could ask you all these questions, by the way. Vertebral foramen. You have a triangular large vertebral foramen. You have a hatchet or rectangular thin spinous process. You have a kidney bean-shaped body, okay? And you have thin and elongated transverse processes. I'm not going to ask you anything about the articular processes, their angles or anything. All right, when we get to the thoracic area, what we notice is that, and this isn't a good example, here's a good example. The body's heart-shaped. The vertebral foramen is round and small. The spinous processes go inferiorwards and are elongated. And the transverse processes, which don't show here, have facet for the ribs, attachments of the ribs, okay? And also the bodies have facets for the ribs. These are demifacets, so you have one above and one below, making a whole facet for the rib to attach. Okay, now for the cervical, you have a rectangular narrow body, a large triangular foramen, vertebral foramen. You have transversarium foramen, the major point that really differentiates the cervical. What blood vessel goes through there? think of what it's going through. Vertebra, vertebral artery, so the vertebra. Okay, it has a spinous process that is bifid. Okay, and that's basically it for those. All right, so that would be one of the things that I would be asking you. Give me the scapula. Give me a scapula. I would expect you to be able to know that the scapula is like this. Okay, not like this, not like this. I've gotten it like this. Okay, so make sure that you know the scapula and know the different parts of the scapula. Supraspinatus fossa, infraspinatus fossa, spine of the scapula, acromion process of the scapula, glenoid fossa of the scapula for the ball and socket joint of the shoulder. This is the coracoid process, okay? And then underneath here, or on the ventral surface, would be your subscapularis fossa, okay? All right. Okay. What I want you also to palpate today are the floating ribs. You could do it either anteriorly or posteriorly. I'll show it to you posteriorly right now. So what you do is you look for the end of the rib cage. Here's his iliac crest. Look at how close it is. It's like just 2 inches difference between the two. All right. So here's his the end of his thorax. All right. The 11th rib is approximately 6 inches. What that means is that it should be found right around the mid-axillary line. Mid-axillary meaning the line that comes out from the armpit midway on the lateral view. Right here is his, okay? What you do is come down, feel the end, then palpate and look for a rib that you feel like there's an end there, okay? You just feel like you come to an end. It's not a continuous rib. That is your 11th rib. Then just about at the same level, come back, and you should be able to palpate the 12th rib. And that's a little harder, especially on men, because their erectospinal muscles are really developed well, so, and it's in that area, okay? So here's his 11th, and the 12th is like 4 inches, approximately 3 to 4 inches long. This is about where his is. Does that feel like a rib to you that I'm touching? Yes? Okay, I'm sorry, it's tender. Okay. That, again, is gallbladder 25. That is liver 13. All right? Okay, so you find those also. All right, the other thing I want you to be able to do are the triangles of the neck. So you want to turn over and... Okay. All right. So we know there's the anterior and posterior triangle. The anterior triangle, the border on the anterior is the midline of the body, and then if you turn the neck here, you see his SCM, or sternocleidomastoid. There are 2 bellies to the sternocleidomastoid, as you can see here. This is your lesser supraclavicular fossa. In this fossa, you will find the internal jugular vein, okay, right here. So this here, the anterior border of the SCM makes the posterior border of the anterior triangle. The superior border is the inferior border of the jaw or the mandible, all right, and then the anterior border is the midline, okay? While we're in this triangle, there are 3 things we're supposed to be able to find. Remember, chi, common carotid, internal jugular, and hypoglossal. So hypoglossal nerve you can't find. But if you can, try to palpate the common carotid, and he has a good one right there, pulse. It's right level with the superior border of the thyroid cartilage. Okay, you should know that also, which is at the level of C4, C4, C5, right there, C4 to C5. Hyoid bone is right up here. If he swallows, you should feel the bone moving. There it goes. And that's the hyoid bone, all right? Now, you come across here, okay, and that's right where you're gonna find that common carotid artery in the pulse, okay? Just for your knowledge, in between the two bellies of the SCM is large intestine 18, and then in the posterior border of that SCM is Sanjal 16, all right? And right into the supraclavicular, the lesser supraclavicular fossa, you have stomach 11, all right? So, and stomach 9 is over here, okay? And then stomach 10 should be right in here. All right, so now let's go to the posterior triangle, all right? So, all right, so now you can see the SCM good, all right? And it comes, you will look for his trapezius is right in here, all right, comes right around here, okay? So his inferior border is the clavicle, his anterior border is the SCM, and the posterior border is the trapezius muscle, all right? In there, there's also another triangle, which comes across in the anterior corner of that triangle, which is the omohyoid triangle. You also can find in there the pulsations of the subclavian artery in that area, okay? Now, this whole fossa in here is your greater supraclavicular fossa, right here above the clavicle, okay? In the posterior triangle that we just described, we have base. We have the brachial plexus, which is in here, in between the two scalenus muscles. I want you to try to palpate them. They're gonna be kind of hard, but they should be right in this area here. It should be the anterior one. So if he rotates, you should, and then comes back, you should be able to feel it contracting right in here. All right, same thing with the medial one, all right? The posterior one is a little more difficult to find. You get off of the trapezius muscle again here. Remember, the floor, the muscles of the floor of the triangle is the semicapitis, the semispinalis capitis, which is right here superior, all right? And then just below it is the levitator scapular, okay? How you differentiate the levitator scapula is you shrug the shoulder and you feel it contract right in there. How you differentiate the posterior scalenus muscle from that, because it's just medial to that, is, again, he shrugs his shoulder, and right in here would be your posterior scalenus muscle, okay? All right, as I said, the mnemonic for the contents of that posterior triangle is base, brachial plexus, accessory nerve, subclavian artery, and external jugular, okay? And Kathy has a bifid external jugular, which is an anomaly. So take a look at it. All right, she has two rami of the. Both sides? Yeah, I don't know, was it one side, right? It was the right side. Yeah, so she's exceptionally beautiful on that side, because that's all the blood goes to the facial muscles and the nerves and whatever from the external jugular. So look at that one right side, that's very beautiful. Okay, I think I went through everything. Was there anything that you could think of that I missed? I think I got everything. Well, start, and if you have any questions, I'm here. We'll go around, get the bones, get out the skull, look at the skull, because you could do the skull, you could do the scapula, you could do the ribs, you could do the sternum, okay? You could do the vertebra. Those are the bones that I can lay out, and you could tell me everything you want about them. Okay? All right.